If you've got Jewish ancestry and you're thinking about having a family, go and get tested for Jewish genetic diseases. Early and complete screening is important. Personally, I conduct on average about 12 weddings a year, and I get to work with these couples towards wonderful celebration. But it's also my job as their rabbi to make sure that I talk about Jewish genetic disease testing before they get married. In fact, I talk to them about it during their first meeting with me. Carrier screening is one of the very first things I bring up with a couple. Regardless of whether or not I do the wedding, I make sure that they leave my office with solid information. They leave with a copy of a brochure, and they know to go talk to their doctor and find out about getting screened as soon as possible. There seems to be a common misconception that couples of mixed ancestry aren't at risk for Jewish genetic diseases, and I explain to them that this is simply not true. Even if only one partner was born into a Jewish family, I encourage them to go and get screened. Even if a couple has told me that they've already been tested, I strongly urge them to go and talk to their doctor. New tests are added to the screening panel regularly, and we want to make sure that their tests are up to date. I know that some couples are really reluctant to talk about difficult topics, especially the thought that one of them might be the carrier of a Jewish genetic disease. But it's my job as their rabbi to help them address the really tough stuff before they get married. As a matter of fact, I ask each and every couple to fill out a family tree. I use this as a bridge to talk about family relationships and to see if there's perhaps any history of inherited diseases in their family. I do stress that even without a family history of Jewish genetic diseases, that someone in the couple might be a carrier and they are at risk of having an affected child. I am really insistent that my couples get screened before they start planning a family. I've had several couples who were carriers for the same disease, and while it wasn't the results that they were hoping for, ultimately they were very thankful that they had found out early. Over the last 3 years, we at the New York Board of Rabbis have worked very hard with our partners to make sure that our members understand the important role that they play in teaching couples about Jewish genetic diseases. As a result of this training, I'm happy to say that many of my colleagues are now talking about the need for early and complete screening. Once I marry a couple, I consider myself to be their rabbi for life. And I want to hear about the joyous moments of their lives, and I'm here for them in difficult times. But I'd always rather hear about the fact that they've had healthy children, to celebrate those life cycle moments with them, than to hear that they have had a child born with a Jewish genetic disease that could have been prevented.